So Liz, as you know, the mission of Thermo Fisher Scientific is to make the world a healthier, cleaner place. And as part of that, transplant diagnostics is focused on improving the lives of transplant patients and their families. And we've made a number of investments within that space to improve patient outcomes and their quality of life. One area we've really been focused on is non-invasive or less invasive tests, and would just love to hear your perspective in terms of how does that fit in with the Olaris mission and the technology that you've developed and are looking to bring to market.
Yeah, that's a great point. And again, I think just our shared missions is why we're so excited about this partnership as well. So Olaris founded on the principle to remove the guesswork from medicine, and that can take many different forms. In the case for transplant, I think you bring up a really great point, is that we got to get away from the biopsy and these like really scary, intense, invasive procedures, and be able to use some of this new innovation that can bring right to the patient and tell them like they're okay, right? You don't need to worry. And so that's what our test, myOLARIS-KTdx, does. It's a non-invasive urine-based test that can tell a patient, are you at risk for rejection? Are you at risk for an infection? Or are you okay? And just think of how powerful that can be.
Absolutely. I think they'll just transform, I think, the patient experience, but also provide that clinically relevant data that can make the best decisions for the health.
Yeah, absolutely.